Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2 Lift in our Expert on the Microphone series. Today, we're joined by two highly skilled plastic surgeons. Recurring guest, Dr. Brad Calobrace, the founder of CaloAesthetics and CaloSpa. He's a respected, world-renowned authority in both plastic surgery and non-surgical aesthetic treatments, receiving numerous top doc awards by both patients and his peers. Joining him is Dr. Juan Quintero, with over 16 years of aesthetic plastic surgery experience in Kentucky and being recognized for both his dedication and exceptional patient care. He has joined forces with Dr. Calobrace, where they are both recognized leaders in aesthetic breast surgery. And that's exactly what we'll be talking about today, specifically Motiva Breast Implants, which are one of the most used breast implants worldwide, but just gained FDA approval in the US in September of 2024. Now, Dr. Calobrace was impressively the first plastic surgeon in the United States to perform a breast augmentation using FDA-approved Motiva breast implants. Welcoming now to the show to tell us all about it are the experts themselves, Dr. Brad Calobrace and Dr. Juan Quintero. Welcome, superstars.
Thank you, Zen. Thank you. Good to see you.
Good seeing you.
We're glad to be here.
So excited to have you back on, Dr. Calobrace. So let's start with you.
Okay.
You are, well, let me acknowledge, thank you so much, Dr. Quintero, for joining us today. Your expertise is going to be invaluable to help us bring the message home. So, Dr. Calobrace, you are a recognized authority on breast augmentation and breast lift surgery, and I know you were directly involved in the FDA clinical trials that led to the approval of Motiva breast implants for use in the US, and even serve as the medical director of the FDA's post-approval study. What differentiates Motiva breast implants from other implants on the market, and can you share insights into your involvement in this FDA clinical trial?
Because I travel so much around the world and, a leader in breast implants, it's been years since we really had new innovation. But I would see internationally that for the last 14 years, they had this implant called Motiva implant. So many years ago, I got involved with Establishment Labs out of Costa Rica, who makes the Motiva implants. And so I've known about it. I went down to Costa Rica, did surgery with it. I've lectured and traveled around the world talking about it. And for all those years, there was no FDA approval, so I personally couldn't use it in my own practice. Starting in 2018, Caroline Glicksman out of New Jersey, who many of you guys may know, led the first FDA trials of the implants, which are both in breast augmentation and breast reconstruction. And when we got to about 4-year data, the FDA, through its very strict requirements, approved them for breast augmentation, that part of it. It's still not approved yet for breast reconstruction, but for breast augmentation, because of the scrutiny they put towards these implants. What's different about Motiva implants? The Motiva implants are different in almost every way. They have a different surface called a nano surface, or a smooth silk surface that's 4 microns, so it acts like a smooth implant, has that very, very minor texture to it. But because it has this very smooth surface, it creates a non-immunogenic, non-inflammatory, non-fibrotic surface. So you don't really see capsular contractures. The rate's less than 1%. They actually construct the implant as a monoblock, so the shell and the gel are connected as one, and it creates a low rupture rate at less than 1% at 10 years. And it has a very viscoelastic property, so it's very stretchable. So you can put it through small incisions and move it, and it turns into more of a teardrop-shaped implant when placed in the body. I could go on, but it's just so different than the implants we've had in the past.
Sounds a little bit safer than what we've had in the past. And I know for those suffering from breast implant illness, this could be a saving grace, or perhaps a light at the end of the tunnel, right? So I love it that we're highlighting this. Now, Dr. Quintero, let's shift to you. You are a specialist in breast surgeries and have experience with Motiva as well, with many more patients lined up to receive these specific implants. Who would you say is the ideal candidate for Motiva breast implants, and what factors do you consider when recommending them to a patient?
So thank you for having us again, Sen. Actually, Motiva in general, it's ideal for pretty much everyone. However, who would I shy away from? It depends more on the chest wall anatomy. Somebody who has a sort of like a sloping chest wall, like Dr. Calobrace mentioned, that there's no capsule being formed by these implants like the other implants had. And so it probably, you don't want somebody with that type of chest wall where that capsule won't form and the implant can actually drop too much. So ideally, we have other techniques to help with that. We're putting now internal bra support in those type of patients. So actually, Motiva can also be used in those type of patients. But ideally, Motiva has rejuvenated, and you mentioned it. Actually, it actually has targeted not only the physical but the emotional and the mental aspect of a lot of patients who had some concerns about, other implants creating diseases, etc. So pretty much, it has rejuvenated the breast implant industry in that aspect, because we haven't had anything like this in the last 10 years or so. So we are looking forward to continuing to do more of these surgeries, and we'll keep up with with the studies, obviously, as always. But I think
Yes.
it's actually ideal for pretty much everyone, particularly capsular contracture patients who are getting this as a secondary. I was just telling Dr. Calobrace, I had a patient that had two capsular contracture, was done with implants. We're going to just take the implants out. And when she heard about Motiva, she was like, I'm willing to go one third time and try to be. Also, people who had concerns about possibility of, ALCL breast cancer induced by the implants with the old type of technology, the texture surface, etc. But still, it's all communication, knowledge, and understanding of what this implants do versus the older implants.
Yeah, there's been no cases of lymphoma associated with this implant, so it acts like a smooth implant. There's been no lymphomas from smooth implants either.
Right.
So it gets confusing because you almost could call it a texture because it's 4 microns, but it really in every way is smooth. The other person who I think isn't a great candidate is somebody who wants a really, really large, overdone, over-augmented look, because it doesn't really form a capsule. So you can imagine it may stretch the tissue more than you want it to. So I would just say, everybody that wants a really natural, normal breast and perfect breast and wants to feel that this implant is as biocompatible as an implant has ever been. And by biocompatible, I mean the body sees it as self and doesn't react to it with
That's
fibrosis,
important.
inflammation. And it is. So that you mentioned this idea. I think there's this whole idea of implant hesitancy. People are
Well, let me
concerned.
tell you,
Yeah.
not only are you spot on, and right now, whether we digress just a little bit, but I do want to address the breast implant community because I suffered from breast implant illness and just recently took my breast implants out 1 year ago, December 18th, and did not choose to reimplant for this very reason, opted for just a natural, anchor lift,
Yeah.
and paused and want to proceed with caution. And I'm waiting to see what's available on the market. This sounds very interesting to me.
Yeah.
I never suffered from BII in my life, but when there was a small rupture with
Yeah.
my saline implants, I only had 250 cc's, the mold accumulated around that valve, and that mold was causing my body to react very poorly until they were removed, and the mold was actually discovered and sent to a lab for testing, and it was the highest and the most dangerous mold spore of that, the equivalent of what you would find in a washing machine. So putting something into my body, it was very scary. But now I have to say, with the education I'm ingesting in this interview, I'm feeling more comfortable. So big shout out to the women out there that know that I'm a big advocate for breast implant illness, because I don't believe it's a hogwash. And you both said it. These have clinical trials and, more importantly, the biocompatibility. So let's chat about the healing process, Dr. Calo.
Yeah.
I know that the Motiva breast implants are known for having less of an inflammatory response and offer a smaller incision to reduce that visible scarring. And going one step further, there are products out there like the CO2 Lift
Yeah.
Pro that could further aid in recovery post-procedure. I use them after my explant surgery. By the way, I used this Pro mask all over my incisions and it was amazing. So in your experience, how soon can patients return to daily activities and more strenuous exercise after implanting? And what methods do you recommend to manage discomfort during the recovery period?
Yeah. So we believe that, Motiva implants are unique in that they don't really create fibrosis. So the need to do massage and do all of that isn't necessary because these soften up very, very easily. We let people go back to regular daily activity within a day or two. They're very, very quickly back to work in 2 to 3 days. We don't let them exercise for 3 to 4 weeks afterwards, but normal stuff, we don't want their heart rate to go up till about 3 weeks after surgery. At that time they can start running and doing things like that. So it's quicker than people think. What's changed also, Zen, which maybe people don't understand, is historically for years and years, me included, we placed implants under the muscle, right? That creates a lot of distortions of the breast implants, a lot of pain for women and fibrosis. It's uncomfortable, especially women who work out. But beyond that, it's not the natural place for an implant to be. We did that because we needed to reduce the risk of capsular contractures, because if you went above the muscle, it was just too high. The implants got too hard over time. The Motiva implant, whether it's under the muscle or above the muscle, has the same low capsular contraction rate, which allows us now to place the implants above the muscle in a more natural position, as long as somebody has enough tissue coverage. So you have way less pain and recovery after that, in a more natural look with the implant. It's powerful in its ability to allow us to use all the pockets differently, go above the muscle, less pain and problems for our patients. Super powerful.
Right. Right. Exactly. It all makes sense. And the science is the science. Now, Dr. Quintero, with your extensive experience using various types of breast implants, how have your patients responded to Motiva implants in terms of aesthetics, comfort, and even overall satisfaction compared to other
Well,
options?
so far, I would tell you, since so good, because I'm telling you, every patient has been excited. We're noticing that people are very educated, and they're coming into the practice knowing already what Motiva is and brings. So they already know. I had a patient yesterday that literally was waiting for Motiva and was going to go to South Korea or maybe Turkey to have Motiva implants done until we finally release them in the US. So, I mean, people are coming in knowing, and knowledge is power. They're very, very happy with the immediate post-op results, the softness, the recovery. I think it brings, again, this mental health sort of comfort. If
Comfort.
Yeah, it's just, I don't know how to express it.
Peace of mind.
Peace of mind. It's peace of mind, because they have done the studies. They know, we presented with the science, and they say, wow, in 14 years of being out there, in 6 years of FDA approval, more years than any other implant in the industry. The other implants had a 2-year FDA, studies for the most part.
And I hate that, Zen, you had that experience with breast implants.
Yes.
I can't even tell you how much I hate it. For somebody who knows about breast implants really well, I always tell patients, I may be an implant advocate because I've published a ton on implants, but I'm mostly a patient advocate.
100%.
And just because the patients had implants doesn't mean they have to have them. We have found, I've published a lot on techniques to take out implants and reconstruct, as you mentioned, breast lifts, auto augmentations, fat grafting. We have a lot of options. But sometimes, even when we do all of that, the patients miss their implants, and they just want to feel comfortable with an implant because they like the look of it, and they kind of need the look of it in a way because they don't have their own tissue. This really does open up at least a dialogue that we can have with them for the future. Maybe if we get some more information, more data, even you may someday go, you know what, I'm feeling much more comfortable about this implant now. And I kind of miss some of that volume, so, but we only want to put implants in keeping patients healthy.
Yeah, there's an excitement and a shift in patients that actually, as many explantations as we were doing, now I think some of that tide is actually changing into consideration again of saying, like, wait a minute, I don't have to explant. Maybe I can, just remove and replace.
Yeah.
So.
Yeah. And now with the Motiva implants, the modalities post-surgery for healing and scarring and decreased bruising. Talk to me about how you're incorporating the CO2 Lift Pro gel with post-procedure.
CO2 lifts are powerful, and maybe Juan can do that. They're really great. We had a patient the other day who was struggling with circulation to the skin. We had one with a tummy tuck, one with a nipple, because we do a lot of breast lifts and we have a lot of incisions. We're moving tissue around. We needed to stay alive. What's powerful about the CO2 lift, which is carboxyl therapy, which is really CO2 that goes into the tissue. And when it does that, it delivers more oxygen to the tissue, and it increases the blood circulation to the tissue. So we see that things that are on the edge start to recover. So you can imagine in scarring, and as scars matter, if somebody's worried about it, you can use as you mentioned, you can use the CO2 lift to drive in more oxygen, drive in more hydration, drive in more circulation, increase the elasticity of the tissue, which can be extremely powerful in getting them through the healing process. So that's how we use it. You can use it. Anybody that you feel like has any need for it, use it, or you can use it routinely for that. So we'll use it in both ways, routinely and or selectively in patients based upon what's going on with them.
Carboxy, definitely. Carboxy therapy has been around for many, many years, since the 1930s. I mean, they've injected CO2 into the actual skin for hair growth and all kinds of different things. So now having this gel and this mask, it's an extra weapon that we have to adhere to scarring. I'm a big proponent of it. I use it actually in all, it's not related to breast implants, but I use it in all my vaginal rejuvenation procedures, which I do a lot of those. And also we're using it in scarring, obviously the face. So it's very, very powerful.
Yeah, the V-lift. So when he
The
does
V-lift.
any vaginal surgery, he uses the V-lift and things like that with carboxy therapy, because you can imagine increased elasticity, increased circulation, increased hydration, increased circulation. All of that matters in the healing process for those surgeries.
Yeah, well, you said it. Listen, this is coming directly from the experts' source, right? Like
Yep.
you are really advocating, because the science is the
Yes.
science, and I love that. In particular, this company CO2 Lift has clinical research, clinical data verification. They're really all about crossing their T's and dotting every single I. And I love that they have voices like both of you experts to really advance and make other peers within your community comfortable with using these products. Now, before we wrap up here, I have one last question for both of you. You both are clearly at the forefront when it comes to education and innovation. I mean, Dr. Quintero, you've been honored with the John W. Price Award for Excellence in Teaching Medical Students, and are the past president of the Kentucky Society of Plastic Surgeons, among many other incredible titles. And of course, Dr. Calobrace, you have dual clinical faculty appointments with with the Departments of Plastic Surgery at the University of Louisville and the University of Kentucky. And we know all of those multiple teaching honors over the years that you've received, whether it's Motiva Breast Implants or CO2 Lift. You both clearly stay up to date with the latest technologies and techniques in the field, which is of the utmost importance in an era of such rapid advancement and misinformation. So I love that you really know your information. So why do you believe ongoing education for both students and practicing health professionals is so important? And how do you both personally stay up to date with advancements? Dr. Calabrese, you go first.
Okay. So, yeah, I've been in education like my whole career, and it's just gotten worse, maybe worse and worse, and more. So, I spend a lot of my time. I'm gone probably every other weekend, traveling around the country, around the world, teaching, lecturing, advancing plastic surgery. The only way you can make it all better for everybody and help as many patients as you can is by educating others. I can only do so many surgeries, right? But when you educate others, I also have medical students. We have residents from the University of Louisville in Kentucky. I also have a fellowship in aesthetic surgery that lasts a whole year. We have a fellow every year. I also chair the fellowships for the whole country for the Aesthetic Society. So I kind of overview and review and sort of supervise all of the fellowships with aesthetics. It's extremely important for plastic surgeons to try to be less promotional in their own practice and more educational. It serves patients better because you are going to be educational. You're going to be expanding your knowledge to all of your colleagues to help them be better at what they do for each patient. That's what's really powerful in my mind.
100%. So the perfect example of it, you're talking to the master and the teacher and the student right here.
Oh, he was my student.
I was a student 17, 18 years ago. So education is definitely power. And I think that's towards the patients first, right? And obviously to our peers and students, etc. As a matter of fact, my daughter is going to be attending medical school next year. So I'm super excited. And clearly, I want to perpetrate that to the younger generations to understand that knowledge, science, evidence-based medicine is power. And that's what we pride here. Every day, what I like about this interaction more than anything is we discuss, and we are just always in the forefront. He's traveling all over the world. We go to different meetings together. We bring something back from a meeting. We discuss it. We see the pros and the cons. That's with the fellows, with the nursing staff, with everybody, because everybody has to be educated. So it's always really powerful and really exciting. When you are in a practice by yourself and you don't do these things like I was in the past, sometimes you kind of sort of get disconnected with that touch. And I hate to say it, but a lot of our peers are like that. So I think this is clearly where it's at in the future and should be.
And thank you for educating as you're doing, Zen,
Yes.
on this radio, because I can only reach so many people, but you can reach a lot more people with programs such as this. So we really appreciate it.
Oh, we love highlighting your voice. Thank you both so much for joining us. It was incredible and really informative, and not were you just informative, but you were transparent, which I love. You admitted the faults of the past techniques. You talked about the new things you've learned. You talked about the trials you went through to bring this to market safely and effectively for your patients. And most importantly, you talked about the importance of education and knowledge is power. And I truly believe that if as doctors in your field, as professionals, as experts, if you are not properly informed, Dr. Quintero's point, and you live in a bubble and you're disconnected from your peers and the advancements in the medical world, then you're doing not only a disservice to yourself, but to your patients.
Yes.
And that's at the end of the day what it's about. It's all about serving the patients ethically and effectively. So thank you both.
Yep.
Thank you,
then. We appreciate it.
That was our Going Deep segment, brought to you by CO2 Lift and our Expert on the Microphone series. And that was the incredible Dr. Brad Calobrace and Dr. Juan Quintero of CaloAesthetics and CaloSpa in Louisville, Kentucky. Definitely learn more about what they have to offer at CaloAesthetics.com and on the gram at CaloSpa. And to see more of Dr. Calobrace, you could head directly to his page at Calobrace, and more of Dr. Quintero at Dr._Juan Quintero. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to CO2lift.com.